This is the link. It's brought to you by Carrier 647 Cool, Cabo Enterprises, IT&E. Let's go now to the KUAM News Zoom room where we have standing by. She's the spokesperson for the Department of Public Health and Social Services. Of course, Janella Carrera. Good morning, Janella.
Hey, good morning, guys. Can you hear me?
Yes, you're good. You're good.
Morning. Can we just jump right into, because I had a question about testing from a friend before I started the show. And so if we could just kind of start there before we jump into everything else. What is the protocol? Let me just tell you a story I heard this morning, and this is involving some positives that out of, I want to say AK. There's a guy I know who works at AK, wasn't tested, pretty sure has the virus, is displaying all the symptoms, and now the wife is infected, but they basically were saying like, oh, they didn't want to go get tested because the line of public health is long, and then, you know, one of the clinics is charging $150, so these people don't have insurance, right? And so I had said, because we've heard on the show here from the various doctors that there are ways to get tested at no cost to the patient. But again, there's always that confusion because we get some people in the comments where they say, oh, this clinic charges, this one doesn't. Public health, we know that if you're a close contact or, and maybe you could just clear that up. And I'll just give you the floor to just tell us once and for all, what is the testing protocol for COVID-19?
Sure. Yes, I'm glad you asked. So, you know, we have tier 2 clinics, right, that offer testing for patients who may need testing or who may be requesting testing because they may be close contacts or may be symptomatic. We have currently right now some clinics that do have the Abbott machine. And if they have the Abbott machine and patients go in to get tested, the testing itself, the testing component itself, is at no cost to the patient. If you go into clinics that are tier 2 clinics that do not have the Abbott machine, and say you have health insurance coverage, it's still at no cost to the patient, but there may be a clinical assessment that's done to the patient, particularly if they have symptoms, if they're symptomatic. There may be a charge for that. Now, if you have health insurance coverage, then you know, the health insurance provider may be billed, and then there may be a copay for that. If you don't have health insurance, typically what the provider, the clinic will do is, you know, they'll ask the patient up front, you know, do you have health insurance? And if you don't, they'll send you to public health, and public health will take those patients, and that's why we have our Northern Health Clinic up in Dedido. So we do take patients who don't have health insurance, who are self-pay, MIP or Medicaid patients, and we have been. We haven't turned any patient away. We haven't turned any individual or anybody from the public away, regardless of your ability to pay. There are close contacts for companies. Now, I've heard about companies who have, for example, if they have a positive case or multiple positive cases and they want to do mass testing for their employees because they have, you know, a large number of employees that need to get tested. And so they'll arrange for testing for multiple employees. And in that scenario, many times they'll actually arrange for payment of their own employees because, you know, they want to ensure that there's a continuation of services. And so they'll make that arrangement with the clinics themselves. And most of the time, the company will actually pay for the testing themselves. Now, if there's a private insurance, most of the time what will happen is the individual will go in and get tested. And if the clinic doesn't have the Abbott machine, the clinic will send those specimens to DLS. But that will be billed through the health insurance provider. So I hope that sort of clears up some of the confusion, because I know that there has been some, you know, some people saying, well, you know, I go to one clinic and I get charged, and I go to another clinic and they'll say, no, there's no cost. But the bottom line is, if the clinic has the Abbott machine. And so we do have 3 clinics that have the Abbott machine right now. That's AMC, Guam Medical Care, and then we also have One Love Pediatrics. There are also, there's also Guam Radiology that has the Abbott machine. And then of course there's GMH that has the Abbott ID, and I believe GRMC also has the Abbott ID machine. But basically, if you have your private health insurance and you go to a clinic that doesn't have the Abbott ID, then it is billed through the your private health insurance, and that specimen is sent to DLS by that clinic,
Right.
And then it's run through DLS.
Again, Janella, let's say I, a close contact of a positive, I don't have health insurance. What are my options? I know you might have said it before, but just again, if we could, for the audience.
We would probably advise you to contact public health directly. And in that scenario, public health will provide testing at no cost to the patient.
Is there a number for that?
Yeah. So you can call 311 and option 1. And if you can't go through to that, because we do get a flurry of calls,
Yeah.
and a lot of times, if you can't get through, then we do, there's another option that you can call. It's 635-7525 or 7526. But we do advise, patients that for the 311 number, the voicemail does tend to get full quickly. And if it does, then you can try the 635 number, 7525 or 7526. Or if it rings and and nobody answers, there is caller ID, and they will call patients back.
Okay. So, sorry, just to make this clear, any of the tier 2 clinics that have the Abbott ID machine, it's free. AMC, Guam Medical Care, Guam Radiology, or One Love Pediatrics, right?
It's at no cost to the patients. Now tier 2 clinics will see all patients, even with no insurance.
Right.
They will see them with no insurance. Right.
For DLS, because we do have a question here from our viewer, how long does the DLS machine take? The turnaround time, I guess, for the test.
So I think that, if I'm not mistaken, the turnaround time for that is within 24 hours. Because
Okay.
I'm not sure. I don't think they're running their specimens on an Abbott a machine. It's usually within a few hours, 4 to 5 hours. But regardless, the Joint Information Center, the sit rep, doesn't report those results till the next day.
Right.
And as far as the Abbott, that's the rapid test. That's the 15 minutes, and you get the results.
Right.
Okay.
Right. So just to clarify, the tier 2 clinics, they see all patients as well, regardless, at no cost, even with no insurance to the patients.
Right.
But again, if they have health insurance, it's billed through the health insurance
Right.
provider.
So it kind of sounds like.
And these are, I'm sorry?
Kind of sounds like we just got to do a better job of telling people where they can go get the at no cost testing option. Because people are just showing
Right.
up at a bunch of clinics, and then we're getting there like, oh, this clinic's charging this clinic's charging that, and it's just really that they're not going to the tier 2s, which the tier 2s, again, guys, have been deputized as basically the front line of the community level in the fight against the coronavirus, and they're going to get reimbursed for it, and that's why. All right.
Right?
Yeah. Thanks, Janella.
Yeah,
I know. Go ahead.
Go ahead.
Go ahead, sorry.
No. Go ahead.
No, so I think the bottom line message here is that we don't want to discourage patients from coming in to get tested. If they're feeling symptoms, if they are close contact, and they're looking to get tested because they're worried about having COVID-19. We want them to come in and get tested. There is public health. There are tier 2 clinics. And, they can always call ahead of time, call their doctors. And that's really the bottom line, the message that we want to get across. We don't want them to fear the costs that may be associated with it, and that they can always call ahead of time. And if they feel that, if they're worried and they may be told by others that, hey, there's a cost, I was charged, they can always call. And if that's what they're hearing, there's also always public health that they can contact as well.
Right.
And if we could, Janella, real quickly, the tier 2 clinics again with the Abbott ID rapid tests, AMC, Guam Medical Care, Guam Radiology, and One Love. Pediatrics.
That's correct.
Okay.
Okay.
All right. Can we talk about, before we get into the regulations, the testing that's for this weekend on Halloween? I don't know if it's going to be postponed because of the rain, but
right. We are monitoring that. Yeah.
It might be canceled or postponed.
Right now, we haven't received any word of any possible cancellation, but we are monitoring the weather. But as of right now, we are proceeding. Just one point I wanted to make with regards to the Abbott machine,
okay.
Because it has the ability to test or to produce results within 15 minutes. We use that to prioritize the sick patients. So just wanted to get that out.
Right.
Okay.
So it's a point of care to identify sick patients immediately as well. But to the testing this weekend, we did get word about the circulation that's forming for this weekend, and we are keeping an eye on that. Hopefully, the weather passes. We do want to proceed with the testing this weekend. It's very important to us to proceed with it. We're really looking forward to it. We saw what happened with the testing that we conducted a couple weekends ago.
Yeah.
And the results that were produced with those testing. So we really want to proceed with this weekend as well.
Where did I miss? Where's it at? Where's it supposed to be?
This is the testing with. I'll go ahead and let Janella explain.
Sure, yeah. So we have a community COVID-19 community testing happening this weekend at Estumbo Gym in Dedido, and that's from 9 a.m. to 12 p.m.
Right.
And we're working with, of course, the Dedido Mayor's Office, with the FSM Consulate Office, as well as the FSM Association of Guam. It's open to the first 200 participants, and registration is actually being driven by the FSM Consulate Office. So.
Okay.
If those who are interested in, the free COVID-19 testing for this, registration is happening through the FSM Consulate Office.
Right. Thank you, Janella. Real important to get that testing info out, because what we're hearing from the doctors is people are showing up at the hospital already on death's door because they're just waiting too long. And just anecdotally talking with people I know, they are concerned about not having $200 or whatever it is to go get tested. So thank you for clarifying that very crucial information for us.
Yeah.
And now I know
Sure.
Bree wants to get into this executive order that dropped. The new drop was yesterday.
Yeah, so the executive order came out, as you know, and it did talk about, public health and GPD stepping up with enforcement, and it made reference to the COVID-19 public health enforcement regulations for the imposition of fines for violations. So can you provide us any more specific details about what exactly these regulations are and the fines and penalties?
Sure. So the executive order, what it does is it allows us to speed up the AAA process. And so particularly with the COVID-19 and public health draft rules and regulations. So we are working on the draft rules and regulations now. And the draft rules and regulations that we're envisioning gives us the ability to basically, we've heard from the public, right? There's certain companies and certain enforcement abilities that have sort of that we haven't really been able to really enforce. So we for the past several months, we've really just been kind of going at it a little by little, just sort of encouraging people to follow the executive order. And so what this does, the EO, it just allows us to expedite that AAA process. But it doesn't necessarily give us the ability to bypass it. So we'll still be able to have that public hearing, open it up to public comment and public input, which of course we realize is a very important part of this process. We want to encourage compliance with COVID-related executive orders and public health directives. So that's the purpose of the rules and regs. And it does include a proposal to levy fines for those who are not in compliance with the executive order. And so in the draft rules and regs, it has a scaled version of fines. And this is for both individuals who may be found to not be in compliance with the executive order or public health directives. That's the proposal, as well as for businesses.
Do you have an idea, like how much, what kind of fines we're looking at, like dollar figures?
Sure. So for individuals, we're looking at, it would start at around $100, and it could range up to $1,000. And then for businesses, the proposed range would be between $1,000, so starting at $1,000 and up to $10,000. And it would be just a matter of, for the first offense, second offense, third offense, but it would cap at the 1,000 for individuals and then 10,000 for businesses. But again, this is just the proposal, right, that we're looking at in the draft rules and regs, which, at this point, we still haven't officially released. It's still, in the draft is in the draft form, so to speak.
And I guess the violations, are we talking like a violating what, social distancing? What are we talking about?
Right. So social distancing, congregations of more than 5 people. So anything that would fall within the COVID-19 directives that have been issued in the executive order, public health directives, anything COVID-19 related that have been issued in basically anything that encompasses executive orders, COVID-19 related, and public health directives.
You have any idea when the draft will be completed? Finalized?
We're hoping as soon as possible. There's just a few things that we're trying to ensure that we have, finalized. We really want, of course, we want the public input and the public hearing on this. The AAA process is, as you know, it can be a lengthy process. And by the time, if we go the normal route of the AAA process, by the time we get that done, that could really take a while. But we still want to have, the public input, the public hearing. So we're hoping we actually wanted to get this out and done this week, but there's just some, final touches that we want to put into it. I really can't put a final timeline, hopefully by next week, if not this week. Just a couple of minor things that we want to work on.
So once it's finalized, the public hearing will be held. So are we going to have to give like 10 days notice for the public hearing? And how are it's going to be like a virtual public hearing held by public health or?
Right. It'll be virtual. Right. It'll be a virtual public hearing. I'm not too sure on the details if it'll be, together with the governor's office, or if it'll just be a public health public hearing. That part, I think we're still trying to figure out if that's how we're going to coordinate the public hearing. And then the public comment and the public input, I think we're also still trying to figure out if that's going to be through email, how we're going to, invite the public to make the public comment. But of course, the public hearing is going to be open to the public as well. So we'll invite, the community to participate in this public hearing.
So basically, if I have a gathering with like 28 people this weekend, I can't get a ticket yet? Is that what you're saying? I mean, I would never, but I'm just theoretical.
Well, we still have. Well, we still are, we still are enforcing, the executive order. GPD is still out there, monitoring. Public health is still out there monitoring. As you know, when you hear about complaints at restaurants or gatherings, public health is still going out there monitoring, issuing citations.
Right.
So it's not like you see a large crowd and nobody's enforcing or issuing citations.
Right.
But this, the proposal that we're making is that we'd be able to strengthen that ability and issue fines should this proposal, make it through and be adopted.
Okay.
Okay.
Anything else? Anything else you wanted to get out?
I just encourage people to enjoy Halloween. It's coming up, but safely, and please don't go out if you're sick. Don't stay home and quarantine. Stay within 5 people, and stay within your family if you do decide to participate in Halloween outside of your home.
Thank you, Janella. We're going to run along to Sal Bavalta of GRTA. Appreciate your time this morning, Janella.
Thanks, Janella.
Sure. Thanks,
Okay.
guys.
All right.
Take care.
Take care.
Okay, bye. And we'll keep it in the K-Wave News Zoom room where they just got their, I believe this is their first positive case in